It's Monday, the day of my canceled show. And the pain of the hemorrhoid has actually diminished a little bit, but now it's time to see a professional. Dr. L was a big doctor in khakis and a striped shirt. I liked him right away. His office was located in a hospital. He led me into this huge room with an exam table in the center, but it looked like an operating room. It had machines all over and 3 huge cabinets full of all different kinds of hospital supplies. As we were coming in one door, an orderly was closing the door on the other side of the room. I want to thank you for seeing me. Well, you should thank me. I don't see patients on Mondays. Doing this as a favor to Dr. K. Now, if you could put on this gown, ties in the back, and can I get you to lay on your side with your face facing that wall and your knees touching your chest? He left the room, I put on the gown and assumed the position. When he came back in, he put on a pair of rubber gloves. Let's get to it. Whoa. Well, the good news is it ruptured on its own. Ooh, looks like it had a blood clot in it. I can't tell you how much that hurt. I bet it did. I bet that hurt like hell. Wait here a minute. I want to get my colleague to see this. He leaves the room. While I'm waiting for him to return, an orderly comes in the room. Hey, is the doctor here? No, he went to get a friend of his to look at me. Think something exciting's happening back there. Cool. I need to get some stuff. I didn't move from my position as he grabbed some gauze and a blanket from one of the cabinets and walked out the door. Dr. L came back in the room with Dr. M. Dr. M was an old, distinguished-looking doctor like Robert Young and Marcus Welby, MD. He introduced himself and then went straight to my ass. They both stared at the lump intently for a while and then, the squeezing started. Oh, it hurt so bad. But I could feel the lump losing its power. And then the first finger went in. It was Dr. L. After a few moments of poking around, he turned to Dr. M and said, "You want to see if you can feel anything?" "Sure." And then the second finger went probing. After a few moments, I was wondering who else they were going to invite in for a poke. I imagined Dr. L running over to the door, opening it up, and yelling out, "Hey, come here, you got to feel this." I'm still trying to see everything the doctors are doing, and Dr. M gave me a very sour look. "How can I examine you if you keep squirming around like that? If you were my patient, I would have to sedate you." Dr. L took off his gloves and came up front. "I'm glad I took the time to see you today. This clearly was an emergency. And if it would have ruptured, I would have cut it. But we did get to drain it. Now, I want you to keep soaking. I'm going to give you a prescription for 2 different kinds of antibiotics. A prescription for lidocaine to put on it, and I want to see you in 1 month.